parent would sacrifice their child's life in order to receive attention. A woman named Kathy Bush intentionally made her daughter extremely ill by giving her extra doses of medicine. And her daughter, Jennifer, by the time she was 8 years old, spent 640 days in the hospital, received 40 medical surgeries and 1,819 non-surgical treatments. Over the span of 2 years in the UK and the Republic of Ireland, 128 cases of what is called Munchausen syndrome by proxy was found, in which children were poisoned, suffocated, and received many other forms of abuse. And overall, in all these cases, 85% of perpetrators was the child's own mother. Munchausen syndrome is a parenting disorder in which the caretaker fakes their child's illness or causes real symptoms in order to receive attention. This is known both as a mental disorder and a mental illness and a form of child abuse. Medical professionals must better identify these cases before more damage is done. Certain aspects that play a huge role in Munchausen syndrome is the symptoms that the caretaker creates for the child, the perpetrator's mental state, as well as treatments for both the child and the caretaker. So I will first discuss the common symptoms that the caretaker creates for the child. So Eunice, 2014, from the International Journal of Adult and Adolescent Health, gives us a list of common symptoms, starting with something called sepsis, which is a deadly reaction to an infection in the body. As well as that, there's chronic diarrhea that the child gets because the parent gives them laxatives and things like that. They also they make false kidney stones in the child where they place pebbles in the child's urine. They also do false fevers, which is caused by heating up the thermometer. The child also receives rashes from the trauma, and the caretaker can also do false lab reports by putting salt or sugar in the child's urine. Other symptoms include central nervous system depression, seizures, bleeding, vomiting, and psychiatric symptoms, and unfortunately death. For reported cases, the mortality rates are 9 to 31%. And along with this, Linus kidshealth.org, also in 2015, gives us some more extreme cases, which, ignore that first one, brain damage, destructive skeletal changes, limps, and blindness. And Linus also gives us sort of an insight on the life of the child, what they go through under these circumstances. So these kids they're also known as mystery cases because of so many symptoms that the parent is creating for them. The doctors don't know what to do for them, so they tend to stay in the hospital a lot longer than the average person. And they also receive multiple surgeries, which puts them at risk for other medical problems with each surgery that they get. And then there's also something called the absence of the perpetrator, in which when the parent or caretaker leaves the room, the child's symptoms lessen or go away completely. So it's just their presence that is creating their symptoms. And then along with that is obviously significant psychological damage, especially if the child knows what's going on, which will also result in self-abuse because the child thinks that the only way that they're ever going to receive any love is if they're ill. That's the only way they're going to receive attention. So this creates this sort of cycle where, okay, now I'm ill and I'm going to believe that for the rest of my life, and it may happen to their child as well. So moving on, now that we know more about the common symptoms, we're going to talk about the mental state of the perpetrator. So I believe, I'm forgetting the name right now, maybe it will come to me, but an article says that the mental behaviors can be split up into the desires and diagnosis. So the caretaker usually has a need to suffer, need for attention. They also take up a passive controlling role where they obviously want to be in control. They have dependency needs and erotic desires, as well as abnormal care soliciting behaviors. And then the diagnoses are psychopathy, sociopathy, in some rare cases, schizophrenia, as well as hysteria, and a very common one, which is personality disorder. I'll wrap it up. And then theories, control of they wish to gain control of medical professionals, recognition for being a good parent. They also have an addiction to seeing the doctors, and they just want to know that their knowledge is superior to the doctors. Treatments and recoveries. So the child obviously receives, once the abuse is recognized, they receive protection from child services, and where they treat any existing illness or injury. The child also receives counseling for their trauma. The parent usually faces criminal charges and is a recommended counseling, however, it's not, And the two main issues that decides whether the child is going to go back with the caretaker depends upon the basis of their overall relationship. So if they get along otherwise, then besides the fake illness, they may be able to be back with the parent. And then the caretaker's response to treatment. So the therapy addresses feelings of guilt and shame, and that's it. So thank you.